And as schools are setting out for summer break, the month of May also is Skin Cancer Awareness Month. So this morning we are chatting skin protection suggestions during these hotter months. Joining us live, we have Dr. Alice Zhou with Siteman Cancer Center. Thank you so much for joining us today.
Hi, I'm so glad to be here.
Okay, well, I've been doing my sunscreen every day, at least on my face. So I'm
wonderful.
Yeah, I'm excited for this conversation, though. There's a lot I think that we can break down here. But first, for people that might not know, what exactly is skin cancer? Who needs to be concerned about it?
Yeah, so first of all, everyone needs to be concerned about skin cancer. Anyone that has skin should be concerned about skin cancer. Skin cancer is a cancer that starts out in the skin and is usually in response to UV radiation, which with the beautiful sunny days we have, we're also getting a lot of UV. And so that is certainly a risk factor for developing skin cancer.
Wow. And what are, signs and symptoms to look out for, when looking at yourself or feeling?
Yeah, so anytime you see something on your skin that you're not sure what it is, we think about the ABCs when it comes to the skin cancer. Actually, A, B, C, D. So A is very asymmetry. So if you have a lesion that is not quite symmetric, we worry about that. B is for borders. If the borders are irregular, that's also concerning. C is for color. So if it's dark or getting darker or changing in color, that's concerning. And then D is for diameter. I'm blanking on just how many millimeter it is, but if it is bigger than the spot of like the pencil eraser, you want to get that checked out. Yeah, but to be honest, anytime you have a lesion on your skin that is changing, go get it checked out.
Go get it checked out.
Yeah.
Now, this is something I know I've been trying to go at least once a year. Would you say once a year to check? I've gotten moles removed.
Yeah, so if you have something that is changing, definitely get it checked out. And if you're someone that have a little bit more moles, then they can do mole mapping where they can follow those over time and see if they change.
Yeah. Okay. Interesting. So how treatable is it then if you do find one that does have cancer?
Yeah. So going back to getting things checked out, the earlier you find skin cancer, the more treatable it is. So if you find it early, you can just cut it out or just snip it out, and often that can be cured.
Yeah. Wow.
And how, to that point, might be getting a little deep here, but like how, because most people fear, they're like, oh, I don't want to get cut or something crazy, but you're preventing so much, but is it painful? Is it, intrusive, like invasive?
So it depends on, what kind of skin cancer you have, but for most of the skin cancers, you can do Mohs surgery, which is actually very, very narrow margins, and they just go look for where the cancer is, and they don't cut beyond that. And it's actually it's very non-invasive. It's done in the office, and they often have very good outcomes after that.
Yes,
Definitely.
yes.
And speaking of, you mentioned if you have skin, then you are at risk.
Yes.
And so I know my grandma preaches this all the time when we're on the phone, make sure that you're, wearing your sunscreen, because just because you're black doesn't mean that you're immune.
Oh, for sure. And I think a lot of people wear sunscreen because they don't want to get sunburned. And then certainly people who have more pigmentation, like myself or yourself, we don't get sunburned because we already have a little bit of protection. But that's not going to protect you against the UV damage that causes the skin cancer. So you should still wear sunscreen to protect against that.
Okay.
So there's a myth that people who have color don't get skin cancer. That is definitely not true. The people I see, are across all races, all skin colors, and I think you're more at risk because you feel like you don't need the sunscreen.
Yeah.
Definitely.
Well, Dr. Zhou, you're just a wealth of knowledge. I want to make sure we have time just for this quick question. Does it matter what kind of sunscreen and how often do we need to apply it?
Oh, yes, that is an excellent question. So, ideally we like to go for the physical sunscreen, which is the mineral sunscreen. So you read the labels, and if it says zinc oxide or titanium oxide, that's the one to go.
Okay.
They're usually less irritating and they protect better.
Okay.
And in terms of applications, this is the key part. So most people don't apply enough or often enough. What you want to do is apply, and we call this the rule of teaspoons. So 1 teaspoon for the face and neck, which is a lot, I understand. 1 teaspoon for the front of your chest, and 1 teaspoon for the back, 1 teaspoon for your arm, each arm, and then 2 teaspoons for each leg.
Okay.
So it is a lot. So most people don't apply enough. But what also most people don't do is apply often enough. So you want to apply about once every 2 hours because it rubs off. You sweat and it sort of wears off, or if you go swimming,
Okay, that's really good to know. I have spent days out in the sun, and I'm probably not.
I coated up this morning. I'm good to go.
Right. I'm like, as long as I start started my day. Well, thank you so much, Dr.
Thank you,
Zhou,
Dr.
for
Zhou.
helping
Such
us
a pleasure.
keep our skin healthy. Now, Siteman Cancer Center, they are a wealth of knowledge. They even have a website. You can learn more about your risk, yourdiseaserisk.com. And of course, you can find further resources on their website. Just check out kck.com/showme.